One APIA Nevada is a grassroots nonprofit organization that advocates for policies empowering everyday Asian Pacific Islander Nevadans. Nevada is home to a growing APIA community, accounting for 1 in 10 voters. We are One APIA Nevada. Tonight's episode of Out in Front is brought to you by our season sponsors, Nevada State Education Association, One APIA Nevada, Silver State Voices, and Stefan and Marta Schmidt. Hi, everybody, and thank you all so much for joining us tonight. I am Shelbie Swartz, your host for tonight's Out in Front and the interim ED here at Battleborn Progress. Tonight, we're celebrating a very special birthday for 2 programs that have given millions of Americans the security and dignity of affordable health coverage. Medicare and Medicaid were signed into law 58 years ago this Sunday, July 30th. Nearly 140 million Americans benefit from these programs, including millions of seniors, pregnant women, families, and people with disabilities. To mark this milestone, we're joined by some incredible guests tonight, including Senator Jacky Rosen, Andrea Harris from Protect Our Care, Margarida Jorge from Healthcare for America Now, and our very own Amber Falgout. I'm going to kick things off first with a very special message from Senator Rosen.
Hi, I'm Jacky Rosen, and I'm honored to represent you in the United States Senate. As we approach the 1-year anniversary of the historic Inflation Reduction Act, I want to highlight some of the most important ways this legislation that I helped pass is helping lower costs for Nevadans. This law finally allows Medicare to negotiate for lower prescription drug prices, saving seniors hard-earned dollars and helping put money back into their pocketbooks. In addition to allowing Medicare to negotiate for lower prescription drug prices, this historic law also caps the price of insulin for those on Medicare, well, at just $35 per month. And this has pushed private companies to follow Medicare's lead and cap the cost of insulin. This is exactly why Nevadans sent me to the Senate, to fight for them on issues that affect their livelihood. I made it my mission to do everything I can to lower prescription drug costs and provide Nevadans with much needed relief. Nearly 1 year ago, we made real, tangible progress, but I know we have lots of fights ahead of us, and I will continue working to do what's right for Nevada's hardworking families. Thank you.
Okay. Thank you so much, Senator Rosen, for that incredible video. We are so grateful for all of the work that you have been doing in Washington, D.C. to lower drug prices and protect Medicare and Medicaid. Next, I want to go to our next guest, Andrea Harris, the Director of Policy Programs from Protect Our Care. Andrea, thank you so much for joining us.
Thank you for having me, Shelbie.
Of course. So I just want to start off by having you introduce the work that you do with Protect Our Care. What does the Medicare and Medicaid anniversary mean to you? And what are some things that you are working on to lower healthcare prices and prescription drug prices for everyday Americans and Nevadans?
Sure, thank you. So Protect Our Care is dedicated to making high quality, affordable, equitable healthcare a right for everyone in America and not a privilege. A big part of that is not only defending and strengthening our Medicare and Medicaid programs, which are bedrocks of our healthcare system, as you know, but also expanding and improving other coverage, like a coverage that people can find on the health insurance marketplace, and employer-sponsored coverage, and making sure that that is there for people who need it and that it remains strong. We're really excited about the Medicare and Medicaid anniversary this July 30th. It's the 58th anniversary of those programs. Of course, they feel like bedrock programs to many of us, but a 58-year-old program is actually still relatively new for our country's history. So there are a number of improvements that we're really excited about to the Medicare program specifically, and we'll get into that a little bit more later in the conversation. But before we get started talking more about Medicare and those provisions, I want to share that Medicaid is currently undergoing a huge transition right now. During the public health emergency, Congress implemented a new requirement in Medicaid that prohibited states from disenrolling people who are enrolled in Medicaid. And now that the public health emergency is over, that requirement no longer exists. So states are undertaking this huge process of redetermining whether existing Medicaid enrollees are eligible. And so for anyone watching who relies on Medicaid or knows someone who relies on Medicaid, it's really important that you confirm your eligibility status and stay enrolled, or find alternative coverage if Medicaid is no longer an option for you. And I think Nevadans can do that by visiting medicaid.nv.gov. So I just wanted to share that at the outset. Over 90 million people rely on Medicaid, so it's incredibly important.
Definitely. And thank you so much for bringing that to the audience's attention. That's super important. We need everybody to make sure you have the healthcare that you need. So I want to also talk about prescription drug costs. Can you talk a little bit about the initiatives or policies that have shown promise in making medications more affordable for patients, and what Protect Our Care is doing to lower the price of prescription drugs?
Yes, I'm really excited about this because we've made remarkable progress to make prescription drugs more affordable in the last year. So we're also coming up on another important anniversary, and that's the anniversary of the Inflation Reduction Act, which President Biden signed into law on August 16th of last year. So pretty soon we'll be celebrating that anniversary. The Inflation Reduction Act is actually the biggest piece of healthcare legislation that has been enacted since the Affordable Care Act. The Inflation Reduction Act makes advanced premium tax credits, so the subsidies people can qualify for to buy marketplace coverage, more affordable, and expanded and extended those subsidies through 2025, which is great. But it also introduced new prescription drug affordability measures into the Medicare program. So we know that Medicare enrollees struggle to afford prescription drugs. There is currently no limit on out-of-pocket costs for prescription drugs in Medicare. The IRA changes that, and it does that by also holding prescription drug companies accountable. It introduces measures that penalize drug companies for the first time for increasing prices faster than inflation. So you'll see lower out-of-pocket costs because of that. And then starting in 2025, it caps out-of-pocket costs at no more than $2,000 a year, and provides some new programs that allow seniors to opt in to spread those costs out evenly throughout the year, so that people with high cost drugs starting in January don't have a huge bill. They can spread it out over the year. But immediately it lowered insulin costs. So starting in January of this year, seniors or Medicare, people who rely on Medicare who are on insulin, pay no more than $35 a month for their insulin prescription. And it made recommended vaccines no cost. So for people who are interested in getting the shingles vaccine or Tdap or other vaccinations, they can go and get those for no out-of-pocket cost.
Yeah, I actually have experience with the Tdap vaccine now. I'm about to have my first child in about a month and a half, and so I'm making my whole family go get Tdap. And
yes,
load up. It's
congratulations!
Free. Thank you.
Yes, I had my first baby almost a year ago, so I was doing exactly what you're doing a year ago, like making all the grandparents and anyone who wanted to come visit in the first few months of life get that vaccine. And it's not cheap, so I'm really glad that it's available without copays now for people on Medicare.
Oh yeah, it's awesome. So I also want to touch on the other initiatives that Protect Our Care is working on, kind of on a larger scale outside of prescription drug costs. Y'all have been a leading voice in advocating for better healthcare policies. Can you share some other recent successes that Protect Our Care has achieved, and the impact that they could have on individuals and communities at the doctor's office or as they're seeking care?
Yes. But before I answer that question, I want to spend a couple minutes talking about a big part of the IRA that's starting to take effect right now that I failed to mention earlier. It's Medicare negotiation. So for the first time ever, Medicare can finally negotiate the price of prescription drugs with pharmaceutical companies. And, you know, for people who've been following the Medicare drug benefit since its inception about 20 years ago, drug company lobbyists, as we know, are incredibly effective and powerful. And they wrote into the Medicare prescription drug benefit that Medicare would not have the option to negotiate. And Democrats fought tooth and nail year after year after year to make that an option, or make it possible. And we finally succeeded as part of the Inflation Reduction Act. So September 1st, Medicare is going to announce the first 10 drugs that will be negotiated, that will have their prices negotiated. And you've probably seen the headlines. Pharma's already suing, saying that it's unconstitutional for them to have to negotiate, like everyone else in the healthcare system and in the economy at large. So, it's really important that people understand that that's something that's going on, and it's important work that is closely tied to lower out-of-pocket costs for seniors, and finally putting a check on the seemingly unchecked power of the pharmaceutical industry.
Yeah, we are so excited about that provision, and we just had our legislative session earlier this year, and there was a great bill. I want to give a shout out really quickly to Assemblywoman Considine, who ran AB 250, that would have expanded those negotiated costs to all Nevadans to lower prescription drug costs across the board. It did pass both houses, and then it was vetoed. So we are not stoked about that, but we are stoked that there was such an appetite for our leaders in the legislature to lower those prescription drug costs, because that is the leading issue that so many Nevadans face.
That's huge progress. Another point of progress that Nevada made in this legislative session, which was fortunately signed by the governor, was to expand postpartum Medicaid coverage. That's another issue that Protect Our Care has been working on. It's to encourage states to take up that option to make Medicaid available to people, birthing people for the first full year after pregnancy, and then at the federal level to not make that an option, to make it a requirement. So that's, to answer your other question, something we're very focused on, as well as encouraging the 10 states that haven't yet taken up Medicaid expansion to take it up. We're really encouraged that North Carolina did so in their legislative session this year.
Awesome. Well, just before I let you go, I was hoping you could tell folks how to get in touch with Protect Our Care, keep up with the work that y'all are doing, and stay invested in this fight to lower healthcare costs and make healthcare more accessible for folks across the country.
Thank you. One of the most important and most effective aspects of advocacy for lower healthcare costs is stories. So for anyone listening who wants to share their experience with health coverage and health costs and health quality, we'd love to hear from you. Please visit protectourcare.org. You can reach out to us through our website and share your story. We'd love to hear it and to potentially work with you to come to one of our events. We often have events with members of Congress. We've had our storytellers visit the White House, meet with Speaker Emeritus Nancy Pelosi, former President Barack Obama, our current president. So we really love to bring the power of stories and personal advocacy into these spaces, into the rooms where it happens, so to speak. So please visit protectourcare.org. You can also find us on X or Twitter and Threads and all of the social platforms.
Awesome. Thank you so much, Andrea. It was fantastic to chat with you. And thank you so much to Protect Our Care for all of the work that y'all are doing to make healthcare more accessible, especially as we approach the Medicare and Medicaid anniversary.
Thank you, Shelbie, and congratulations on your new addition to your family.
Thank you so much. Go to our next two guests. We have some of our favorites here with us for the rest of the program. I want to go ahead and bring you in, MJ, from Healthcare for America Now. You are a friend of the show and have always been a friend to our organization. I'm going to come to you first to talk about all of the great work that HCAN has been doing. You guys have always been a leading voice in advocating for better healthcare policies and access for all. Can you share some of the recent successes that Healthcare for America Now has achieved and the impact that they've had on individuals and communities to lower prescription drug prices and healthcare costs overall?
Sure. Well, thanks for having me. And I'm so glad you guys are doing this show to commemorate the anniversary of these programs, which together ensure about half the people in the country. And just as you said at the beginning, Shelbie, it's all kinds of people. It is, people that want to have kids, people that don't want to have kids, older people, people aging at home, seniors that need hospital care, people with disabilities, low-income working families. They're really essential programs. And of course, at HCAN, we have done a lot of work on these programs over the years. And most recently, we worked with you folks in Nevada and many other groups across the country to make big expansions to the programs and to streamline enrollment during the COVID epidemic. And one of the reasons why during COVID, we didn't see an extreme drop in health coverage for low-income people and for kids, even though a lot of people were losing their jobs, was because of course, the ARPA bill and all the work that was done. It was a bipartisan bill to really expand access to Medicaid. Almost every crisis you can think of, whether it is a natural disaster like a fire or a flood or a hurricane, or an epidemic like COVID was, or even a domestic violence threat like we saw in 9/11, one of the first programs that responds is always Medicaid. So it's really a critical program. We're right now working on helping advocates in states figure out how to keep people enrolled, because since the end of the public health emergency, we've seen a lot of people drop off. And of course, don't forget, there's still 10 states that have not yet expanded Medicaid under the Affordable Care Act. And those are some pretty big states like Florida and Texas and states like that. So we're continuing to work on that. The big success that we have had, and again, Nevada, you folks were really central to this, as were the colleagues in New Jersey and New York and Montana and many other states. It was really the prescription drug reforms that passed in the Inflation Reduction Act in summer of last year. These are big improvements to prescription drug prices in Medicare. About 59 million people in Medicare get prescription drugs through Part D. The program has always been really unaffordable since that law passed, since Part D passed in 2003, partially because the drug industry wrote the law. So for 20 years, we have been really trying to overcome the power of the lobby to make some long overdue changes in Medicare. And we finally have them passed into law last year as part of the Inflation Reduction Act, $35 insulin cap, Medicare negotiations on brand name drugs, a new provision that requires drug companies to pay a rebate back to Medicare if they raise their rates faster than inflation, which they do all the time. The first ever cap on out-of-pocket costs. I mean, can you imagine you're a senior and you can pay an unlimited amount as a senior on a fixed income? You can be asked to pay an unlimited amount out of pocket. Totally crazy. So these are things we've been trying to fix for a long time that make a big improvement in Medicare. In fact, the law that passed the Inflation Reduction Act, just in the first 10 years, it's going to save taxpayers $98 billion. So it's a huge achievement in Medicare, really something to celebrate this 58th anniversary. But there's a catch. We haven't yet implemented it. So we still have to work hard to make sure it gets implemented.
Yeah, thank you so much for all of that background. You are just such an expert in this arena, and I always learn so much whenever I get a chance to talk to you about these topics. I'm going to bring in Amber from our team, our communications director. Amber, can you, one, introduce yourself? And then two, can you share your story about Medicaid in light of the upcoming anniversary?
Sure, Shelby. Thank you so much. For folks who don't know, my name is Amber Falgout. I'm the acting communications director right now with BBP. And many years ago, I'm old enough to remember before the Medicaid expansions and before the ACA, I was about 19 years old and I found out I was pregnant. Oops. So I did not have health insurance at the time that covered pregnancy. And at that time, it was a pre-existing condition. So what that meant back then in 2007, yes, she was born in 2007, was that I had to find insurance and find it quick before it could be said that I knew I was pregnant. So what that meant at Nevada at that time was like I said before, the actual expansion of Medicaid. So at the time here in Nevada, you could not make any money. So you could not have a minimum wage job and be on Medicaid. You couldn't work 10 hours a week and have Medicaid. You had to have $0. And so that was not the case. I was working, I think I was making like $11 or $12 an hour at the time, which of course is not at all enough to afford insurance even then. So at that point, the decision was made that I would get married. That is a big decision to make, especially at 19. It was the wrong decision, but it was made for the right reasons. So what happened with that was I was able to get on my then husband's insurance because his company offered it. What also happened about a year and a half into that relationship is he started some domestic violence. And it became incredibly difficult to leave, partly because I had a baby who needed insurance and I needed insurance, postpartum care, stuff like that. So it's a good example of what happens when you don't have access to health insurance in this country, because it's not just that not that prescription drug costs are not a major issue, or that if you have cancer and you can't get treatment, that is not that is also not a major issue, but it's a good example of how pervasive, right, not having health insurance is, in that it can affect every piece of your life, not just your actual health. So it can affect decisions you make in relationships. It can affect financial decisions you make, buying a house, being able to afford groceries, being able to afford rent, all of those things. And so I was lucky enough that once Governor Brian Sandoval, who was a Republican, once the ACA was passed and he did the Medicaid expansion, which I was grateful for, I was able to get on Medicaid at that time. Very shortly after that, I left that relationship because I did not have the same concerns about healthcare and all of those things. It also enabled me, quite frankly, to be able to get my bachelor's degree as a single mom, because I wasn't having to find a job that provided healthcare, because I was able to get that from Medicaid.
Yeah. Thank you so much for sharing that, Amber. I know that's always a difficult story to share, but I'm so glad that you're here with us to be able to provide that context. MJ, I want to come back to you. The health coverage disparities, like Amber talked about, folks having to go to extreme lengths to get covered. Of course, things are slightly better having passed the Affordable Care Act, but these disparities still exist and became more apparent during the pandemic. How does HCAN address these disparities? How do you keep those stories in mind when you're advocating for expansion of these policies? And what strategies do you and your team and your organization implement to ensure that vulnerable populations receive adequate health care?
Yeah, those are all really good questions. And, I think one thing that a lot of people don't realize is that it was only because of the Affordable Care Act, which passed in 2010, that the federal government really started to systematically even collect information about different people of different ethnicities and what their access was to healthcare. So one thing about the Affordable Care Act, which HCAN was created in order to help pass and implement the Affordable Care Act, is we brought 1,000 organizations to the table to pass that law, including many organizations, Black, Brown, Native American organizations, women's organizations, civil rights organizations, racial justice organizations, because we knew that the Affordable Care Act would be the biggest step forward on health disparities that we have seen probably in our lifetimes. And when you look at the data now, 12, 13 years later, we really see that the Affordable Care isn't just the biggest, didn't just do the most for health disparities. It did the most for racial and economic justice of anything that has passed in the last 50 years. And that's because of exactly what Amber was talking about, that healthcare is just a linchpin of economic security in this country. And of course, that's going to be true if one accident, one injury, one birth can put you so deep in debt that it will take you 20 years to dig yourself out. So we have always been really mindful about trying to get to more inclusive coverage. And then there's lots of things that we work on within any policy, whether it's abortion and reproductive health access, whether it's maternity care. We do quite a lot of work on maternity care and Medicaid, or even if it's prescription drugs. We do a few things to ensure that we aren't just reproducing the same systemic inequities that we already have. So one example, for instance, is when we started working on prescription drugs in 2019, we noticed that there was not very much data on how Latinos use prescription drugs. And we really searched, right? We were looking for polling about how Latinos perceive prescription drug use. How do they perceive cost, effectiveness, and then two, what are the ways in which that they use prescription drugs? We suspected, right? There's higher rates of chronic disease, there's higher rates of poverty. So I bet they're using more insulin. I bet they're using more asthma inhalers, but there was no data. So one thing that we did was work with Unidos US to generate a report. We went to some researchers in California and had them crunch the numbers so that we could take that to policymakers and say, listen, this insulin crisis is a crisis. The prescription drug crisis is a crisis. And if we actually address the crisis in the right way, we would be able to not just get more people more affordable drugs, but we would be able to get them to the people that need them the most and have the least access, which still tend to be people of color in this country. So we pay a lot of attention to that, and many of our partners who work both on Medicare and Medicaid, when we are lobbying for policies like expanding Medicare coverage to cover vision, dental, and hearing. That's a racial justice policy, because when you're paying out of pocket as a senior for your hearing aid or for your dentistry, listen, a lot of low-income people and people of color who we know don't often make as much and don't have as much access to resources, they are hit first. And for years I was a canvasser, and I can't tell you how many times I knocked on somebody's door in Alabama or Mississippi, and they told me a horrible story about having to take up a church collection to be able to get a tooth pulled, right? That is a very commonplace occurrence. And certainly we see things, we see that with things like insulin and diabetes, right? Here in Washington, D.C., we have a massive population of people with diabetes, massive population of people with HIV. And it has really been, it has really helped us make the case on the $35 insulin. We need to expand it far beyond just Medicare, because there are a lot of people that are low-income people, people of color, more likely to have chronic kidney disease that can't afford the basic life-saving medicine that's been around for 100 years. So we spent a lot of time working with that, doing the research, figuring out the policy, lobbying lawmakers about it. And then one other thing that we do is we try to work in coalition anytime we can, because the way to be really accountable to health disparities and trying to really tackle them is to make sure that the people who are most impacted by that are at the table and are participating. And that's why we're always working with labor. We're always working with Unidos. We're always working with, National Women's Law Center, all the different constituency groups to make sure that we are holding ourselves accountable, not just for getting to good policy, but getting to policy that really does start to dismantle some of the disparities in the system.
And I also want to, when you're talking about being in coalition and working with partners, I want to give credit where credit is due. I don't know if folks who are tuning in know that HCAN pulled together the coalition that got the ACA passed. That was really on the coattails of not on the coattails, on the backs of your organizers and your folks. Do you want to share a little bit about that as well?
Yeah, I mean, at the time that we put together the coalition, in 2006, 2007, a lot of people didn't think that healthcare reform was possible, right? There had been an effort at healthcare reform in the Clinton years, and it was so traumatic and so painful to lawmakers that lawmakers on the Hill didn't even want to talk about it. Like, you wouldn't even be able to get the words out. Healthcare, they would stop you. No, we're not doing that. But, at that time, healthcare was becoming becoming a huge crisis. And you could tell it was becoming a huge crisis because you started to see groups like Walmart and AARP and the Service Employees Union and the UFCW on the stage together. That's very unusual, right? When Walmart and the UFCW, the United Food Commercial Workers, are on a stage together, and they don't agree on anything. But the one thing that they do agree on is that there's a healthcare crisis and we need to do something to make health insurance work for people. So there was a moment of consensus developing, and people at that time in big institutions, labor organizations, Move On, Unidos US was a great partner back then. They used to be called National Council of La Raza, but essentially every progressive group across the spectrum said, we are struggling, even though our members have good union jobs. Providing health insurance is not sustainable. And the thing that was really becoming clear was that even people who had insurance, at that time we had about 50 million uninsured people, but the vast majority of people still had insurance. But even people who had insurance couldn't depend on their insurance. And this is exactly what Amber was talking about, right? I had insurance that didn't cover maternity care. That was pretty standard back in the day, right? A childbearing woman would buy an insurance policy and would get charged more for that insurance policy than a man, and it wouldn't cover birth control or maternity care. Crazy, totally crazy. So we brought together this coalition really of national groups and started talking to national groups about building counterpart coalitions in states. And I think the thing that made HCAN sort of unique back then was it was really founded on the theory that you would, no matter who controls Congress, and at that time we were going into an era where Congress was going to be controlled by all Democrats, Democratic President, House, and Senate. There was a really clear understanding that you cannot pass a policy like the Affordable Care Act in Washington, D.C. without building a massive coalition across states. You just can't do it. And you certainly wouldn't be able to implement it for sure. And that's, and especially when your opposition is the health insurance industry, the prescription drug industry, pretty much every health industry lined up against the Affordable Care Act. So even with a huge coalition of 1,000 organizations and many other colleagues that were not part of HCAN but worked side by side with us, Families USA and Community Catalyst and many others, it was a huge effort to win that law. And even bigger, and I think it doesn't get as much attention as it deserves, winning it was a big deal. But the fact that we have kept it and implemented it, and that it now insures more people than ever, that it survived the Trump administration, that it survived Republican majorities, it survived the Supreme Court multiple times. It has survived over 80 attempts at repeal. So it really has been an incredible accomplishment. We looked at, when we thought about creating HCAN, we looked at Social Security and Medicare and Medicaid. That's how we knew that we're going to win a policy, and then we would have to defend it for many, many years. This year is the first year since passage of the Affordable Care Act in 2010 that Republicans have controlled a chamber of Congress, and their first priority was not repeal. First time. So that's a big victory for us, right? Because they understand that trying to take away people's health care may be politically not a great thing to do.
Yeah, they're learning finally.
Well, learners took 10 years, but they finally got it. Hope they just keep on with that.
Well, and then we have an extra thing to be grateful to HCAN for, that the ACA and all of that work led to the Nevada public option that we're looking forward to having in a few years. So,
yep. Yeah, I mean, there is a theory, right? We have a theory at HCAN. Wasn't ours. Our partners have had this theory for a long time. Healthcare will get better when we reduce the amount of profit in the system, right? It's all about reducing how much profit is in the system. And because when people are sort of talking about, we hear this all the time, healthcare costs so much more in the United States, right? Well, when you have this much profit, it's got to cost more, right? This system is driven not by, healthcare, it's driven by profit. You see that it's rampant in the prescription drug industry, rampant in the insurance industry, rampant in, all the layers in between. So I think it's really important that states continue to plug away on the public option. And the idea of a public option is a thing that HCAN invented, right? You won't ever see the words public option appear before HCAN existed. We sort of invented that term.
Well, we love you for it. I want to also have you talk about when you, and Amber, I'm going to come to you in just a second, but you're talking about these unchecked profits, these prescription drug companies. Do you want to share a little bit about what you were doing today and how HCAN is working to hold Merck accountable?
Yes. Yeah. So we, really feel, our experience basically tells us that anytime you try to do something to lower profits and reduce costs then for patients, you're going to get tremendous pushback by all the people that make a ton of money off the sick care system. And so during the Affordable Care Act, we took on insurers, the 5 big ones, right? United Healthcare, Aetna. And on the prescription drug fight, we took on the prescription drug corporations, by the way, harder than the health insurance companies. There's like way more of them, and they have so much more money. They really have a lot of money. The prescription drug industry has 2 lobbyists for every single member of Congress. So think about that. And the lobbyists are smart because half of them used to work for Congress. So that makes it doubly challenging. So we did a lot in the state of New Jersey because about, half dozen of the biggest prescription drug corporations, the best known ones, Merck, Johnson & Johnson, Bristol Myers, are actually headquartered in New Jersey. And New Jersey was a really tough place to get the Democratic Senator Menendez, to support prescription drug reform, because the prescription drug industry is like right there in his backyard. So we have been to New Jersey many times. A couple of weeks ago, as the administration is getting ready to announce the first 10 drugs that they're going to negotiate prices for starting in 2024, the drug companies have all lined up to file lawsuits to try to overturn Medicare negotiations at the Supreme Court. Ordinarily, we would not be all that worried about that because these are pretty crazy lawsuits, but this is not just any Supreme Court. And we have seen the Supreme Court overturn things that none of us ever thought we would in our lifetime see overturned. So we are not taking this for granted. The first company to file suit was Merck. So we went to Merck today, and there's some really good video footage of all of our colleagues in New Jersey. We circulated a letter, got 100 organizations to sign on to a letter saying to Merck, you should withdraw your lawsuit and just sit down and negotiate, because for decades, prescription drug corporations have had the monopoly power to charge whatever they want. They became the richest industry in America. Imagine how rich they have to be the richest industry. That's pretty darn rich. If you're richer than oil companies, you're richer than telecommunications, you're richer than, that is a lot. So, prescription drug corporations are so rich, they could lose $1 trillion, and they would still be the richest corporations. And that's what happens when you can set your own prices and then basically hold people hostage to them, because, it's not like people get to decide if they're going to take their insulin or not. They either take it or they die, right? It really is like extortion. So we went to Merck, we chanted, we delivered a letter inside to the CEO, asking him basically to cut it out, stop fighting the law, stop filing ridiculous lawsuits, sit down and negotiate, set an example. Merck is one of the oldest prescription drug corporations. It's the first consolidated prescription drug corporation in the United States. It used to be a very well-respected company. During the war effort in the Second World War, Merck stepped up in a big way to help produce penicillin in the First World War, penicillin for the war effort. These companies used to be much more socially responsible, and their mission still alleges that they are supposed to put patients first. They've had 20 years of price gouging. They have a cancer drug that they made $20 billion off of in 1 year. And they are just really nervous that that's going to be one of the drugs that's selected for negotiations. Most of these drugs are created with taxpayer money. Negotiations is not a new thing. We negotiate prices in the Department of Vets. We negotiate prices in Medicare. Hell, the federal government negotiates prices on reams of paper for their printers at the Pentagon. Negotiations is a normal thing. For too long, these drug companies have been above the rules. Now they're going to be subject to the rules. They're really resistant. So we showed up and told them to stop. And then we told them we're also coming back. If you don't stop, we're definitely coming back. So we delivered the letter. It was a pretty good time. That was blazing, super blazing hot. In fact, I think it's really funny. We were chanting. We got lots of good cameras and lots of people honking, because, of course, prescription drug reform is the most popular thing that's passed in Congress in the last 2 years. But the whole time we're walking back and forth because it's so hot, there's this massive heat advisory. We just kept thinking about the thing that you were mentioning, right? The social determinants of health and health disparities, and how hard it is for low-income people in this type of weather to be able to get access to basic stuff, and the terrible impact that it has on their health.
Oh, 1,000%, especially here in Las Vegas. It's horrible to think about.
Yeah. It's really, I almost, I was coming from DC. It's been very warm here in DC too, but I basically got on the Garden State Parkway to get to the protest, and immediately it was 15 alerts on my phone. Don't be outside, don't be outside, don't be outside. But, I just think to me, one reason why at HCAN we're a coalition of multi-issue organizations, but our focal point is health, is because, all things drive back to health, right? The climate change crisis, here we are in the Garden State, on a day that really exemplifies the climate change crisis. And, we are on the verge of a point where half the food in this country has to be grown indoors. indoors, because climate change is making farming so unpredictable that people are not going to be able to grow food reliably outdoors. And it's, as a healthcare advocate, what's mind-boggling is it's really never talked about, right? It's like somehow food and air and water are removed from health, when all the data tells us that those things are essential determinants of health.
Yeah, we are. Well, folks should stay tuned, because we will likely have an out in front on that exact issue, the impact of climate change on our public health. Amber, I'm going to come back to you. MJ, I love you and all the information you're given, but I want to bring Amber back in so that she doesn't have to sit there. Amber, you were mentioning in the chat when MJ and I were talking about the Affordable Care Act that you had to go to Planned Parenthood for birth control until the Affordable Care Act was passed. Can you share a little bit about that and how else the ACA kind of changed your health future and your access to care?
Sure. I think it's kind of wild to think about, because there's a lot of people who are much younger than I think MJ and I who
I can confirm that. Yes, there are.
Yes. Who know probably only the ACA, which is awesome, but also our history is a good indicator of where we don't want to be. So prior to the ACA, like MJ had said, not all insurance, in fact, not a lot of insurance companies covered birth control. That was not like a standard thing. It was kind of like a thing that you got that you didn't talk about, and it wasn't very like in your face. Insurance companies were like, screw this, we don't need to cover this. So basically what you did, or at least what I did, what a lot of people I knew did as well, was even if I had actual insurance, which I intermittently did, I would go to Planned Parenthood. So I think from the time I was about 15 or 16 till I was about 23, all of my birth control came from Planned Parenthood, which I'm super grateful to them for providing that service, because I don't know what on earth you do if you don't have a group like Planned Parenthood or a way, because they provided it at low cost, right? So I didn't have to pay $200 for a month's worth of birth control pills at the time. That was, I think, the most popular back in the day. It was, I think when I started going there, it was like $25, which is much more manageable, right? Like that is something you can probably do, even if you're working a lower wage job or a job that isn't paying you a ton. So that was super helpful. And I think then obviously with the ACA making birth control free was a huge thing. It's one of the reasons I have had so few abortions, honestly. Like, if I want to be 100% honest about it, it's the reason I've only had one abortion, because I was able to have access to birth control. We know people are still going to have sex, men and women, and they should.
You have the flip side too. It's not just that people, I totally agree with you. It's not just that people can have access to birth control, which means less demand for abortion, but on the health disparities front, it's really important that people have access to routine preventative care for years before they get to the point that they're pregnant. Because a lot of what happens is people, especially people of color, people who have been uninsured, that already have high risk factors, they weren't getting health care. So they didn't spot any of the problems before they got pregnant. They didn't have insurance all the way through, which means, postpartum care doesn't exist. And you need postpartum, not like just for like a week after you give birth. You need it for a full year, 2 years, 3 years, right? So I just think whether we're talking about people that are going to need access to to care because they need abortion, or whether you're talking about people who've never thought about an abortion, but they just want to be able to have a healthy baby and be able to take care of themselves after they have a baby. The Affordable Care Act has been really critical tool for that. And you know what? The other thing is that I was thinking, Amber, as you were talking, is how many places now, what's different for younger generations of people, how many places now don't have a Planned Parenthood clinic? There's no clinic. There's no place to go to get birth control. You might go, there might be a CPC, a pregnancy crisis, where you can't get any medical you can't get any medical advice. Like no doctors work there and they're not going to give you a prescription for birth control. So there's entire swaths of the country where you can just drive miles and miles and miles and you're not going to get to a clinic that can do an STD test on you, that can give you birth control, that can even like give you some basic advice. So times really have changed, not in a good way.
Yeah, that's a great point. I couldn't agree more. And I was super lucky that we had one, especially here in Reno, right?
Yeah,
because like, it's not a widely, or at least back then, it wasn't like Vegas where like, it's a big city. It was a relatively small city. And we had one office here, but luckily I was able to do that. And I think also the ACA and then even with Medicaid, once, because I know birth control was not always covered on Medicaid either. Mm-hmm. So there were a lot of changes that happened with the implementation of the ACA that allowed for those things to be covered. And that increased access substantially for people. Now, I would agree 120% with MJ. We still have a significant lack of access, right? We do. We are not where we need to be. And I think that's one of the things, and I'll wrap up really quick, is that as we head towards the future of how we get healthcare and how we provide it, we really need to look at a system that provides more access to folks for Medicaid. And I know that that is not always popular with a lot of folks, but the fact is that a family of four, I think, what is it? You have to be at 134% of the poverty line, I believe, and that's about $30-something thousand a year for a family of four. That's insane. That is absolutely outrageous in this day and age, that you have to be so poor that you can barely afford to live to get health insurance. Like, think about that. That's just...
And some states just keep moving it further down and further down. And it's really a way to discourage people from even trying to sign up, right? So I just think it's, there is an ideological block in some places where there are just some lawmakers and some people who think it is not the state's responsibility to provide affordable coverage for people. And it just strikes me as being so foolish. I mean, listen, you pay now, you pay later. You can either pay to get young people health coverage and try to do everything that you can to keep people healthy, which saves everybody money, which is an investment in the workforce, which, helps with good birth rates and all the childhood indicators that are associated with a prosperous modern country. Or you do this nonsense that we're doing, where you're nickel and diming people, in a way that there's no benefit. There is no benefit to, especially when you're talking young people, young families, kids, women of childbearing age. There's just no benefit to denying them healthcare. Like that's like a silly ideological debate that costs us a lot more in the future, both in terms of dollars and in terms of lives.
Yeah. And just to add my little 2 cents here, I'm preparing to have a kid and I'm in all these little like mommy groups of other women prepping. And one of the most common posts is about women who are afraid they won't have healthcare coverage, or women who are afraid to see their healthcare bill, or tips and tricks to, get things taken off your hospital bill because they won't be able to afford it. So it's just insane the lanes that we make everybody go to. But in my personal experience,
it's, the next phase, I think, of healthcare, we've made some good strides in coverage. It's fine. But the truth is, like, there's a long way to go. It's just what Amber said. It's a long way to go in terms of the product and actually making insurance work for people. Because when you have 40% of insured people have medical debt, right? So what is the purpose of insurance? The purpose of insurance is to protect you from debt, right? It's to protect you financially, because health insurance is not about providing health care. It's just the financial side of healthcare, right? So when you have this many people, we have very high rates of insurance right now, and people still have medical debt that is still hurting them in other ways. Because then remember, when you have medical debt, all of a sudden it's harder to rent an apartment. It's harder to qualify for some jobs. It's harder to get a loan to go back to school. It's like all those things become harder. So, we have done the healthcare fight is just, it's the fight, right? Because the fact that people have Medicare coverage and they can't afford prescription drugs, or that, some days I am talking to a household that makes $250,000 a year and they're going bankrupt because one kid has cancer. Like, that's crazy. There's something clearly wrong with this product, health insurance, that really needs to be addressed in a serious way to give consumers a type of protection that we're paying for. We're paying for this protection. It should work. If it was anything else, we'd have everybody crawling all over it, right? If you asked somebody to put a roof on your house and the first day it rained, it started to rain in the house, man, you would be like right there with the Better Business Bureau, calling the contractor, doing the whole thing. But with health insurance, consumers almost feel powerless to really do anything about it.
I would have no idea who to even complain to.
Yeah. Well, and also just really basic things like, you call and complain and they're just like, well, read the fine print. Really? Who reads the fine print in insurance? Come on. What masochistic person? Who is sitting home on Saturday night reading the fine print? Come on now. So, they do all of that on purpose. They keep you on hold. Like, they do all these aggressive, we've known for many years, hospital collections and health insurance bill collection is the most aggressive type of collections, right? And so, you just have to really wonder, where is it going to end? Because at some point, we're going to be facing another wave of reform. We're already on the tipping edge of that, I think, in programs like Medicare, where now you've seen so many people get overcharged for Medicare Advantage and not be able to get the services. You have so many people with medical debt. I think really we are headed for another wave of reform that really is about tackling profit, because when you boil it all down, that's what this is. Somebody's getting rich off of denying somebody health insurance, off of saddling somebody else with debt. Even the idea of people living with the stress of this much medical debt, that is a medical issue, right? That kind of stress kills people.
Well, that you kind of touched on my final question. We're coming up on the hour. And then if we have any audience questions, I'm going to pose those to you guys as well. But MJ, I'm going to come to you first, and then Amber to you for some thoughts on, as we're approaching this 58th Medicare Medicaid anniversary, what role do you see these programs playing in the future of healthcare? What is the next frontier in expanding them and expanding healthcare access? It's been 58 years of improving on these programs, or trying to. What's the next big improvement that you see?
Well, I'll just say that if you sort of step back and you look at the US and then you look at other comparable countries, you will pretty quickly come to understand that the number one fiscal and public policy challenge that faces the United States of America is the aging of the population, right? So when you think about what is really going to cost, when you look at the federal budget and state budgets are already, the biggest item in every single state budget is already Medicaid. That number is only going to increase as people start to age. The fastest growing segment of the population is people over 80, right? And guess what? Older people, much harder to insure than younger people. So what do I think the next phase is? I think there has got to be massive investment and improvements in Medicare that include things like cutting waste by stopping drug companies from overcharging. We should be negotiating the price of every drug in Medicare. We're going to save $98 billion in 10 years by just negotiating the price of 20 drugs. So imagine if we negotiated all the drugs. Imagine if we leveled the playing field between traditional Medicare and Medicare Advantage, the privatized plans, and we stopped Medicare Advantage from overcharging taxpayers and overcharging patients for their health coverage, and then turning around and denying people the coverage that they paid for. So I think those types of things have to be done within Medicare in order to long-term deal with the solvency issues. And I also think as more and more people age, there is going to be growing demand for basic things like long-term care, which is not covered in Medicare. If you need a home care worker or you need a nursing home, Medicaid has to pay for that, and Medicaid will only pay for it if you are the most low-income person. Well, pretty soon you're going to have droves and droves and droves of older people demanding those services. And remember, when it comes to politicians, they really think one thing about older people. If they know one thing about older people, it's that older people vote. They vote. So there's tremendous political opportunity there for us to really mobilize people, to drive demand, and to finally make changes in the program that would make it sustainable. But given what is happening with the population and the fact that we have a mass of people, aging at the same time, we need to really get ahead of that. And people who don't believe it, just turn on the news. If you've turned on the news and you've seen the protests in France, right, and the retirement age protests in France about the garbage workers, that's what that's about. It's about the aging of the population versus younger people coming into the workforce. Every single country that is comparable to ours, in many countries, they have sold more old people diapers. In Japan, they've sold more old people diapers for 30 years than baby diapers. Listen, this is a public policy challenge, and the United States is going to be facing that challenge, and we should stop pretending like it isn't so and force lawmakers to deal with it responsibly.
Yep. And Amber, I'm going to come to you for your same thoughts. You've been on Medicaid, you've experienced it, you've been in this fight for healthcare expansion and healthcare access. What do you think is the next frontier of protecting and expanding Medicare and Medicaid?
Sure. Thank you, Shelby. I hope, almost more than anything, I think, that the next frontier is tackling profit, because I think doing that allows us to rein in cost, and I think it will also provide us with a better service, right? As MJ has said, and she's 100% right, there are a ton of people who have insurance, who have medical debt. There's also a ton of people who are in a gap where they don't qualify for Medicaid, but they can't afford insurance, right? There's a ton of older folks who can't afford prescription drugs. It's a situation where the profit drives the industry. And if profit is driving the industry, then quality healthcare is not driving the industry. Making sure people have everything they need as far as healthcare is not driving the industry. So I hope that the next frontier is increasing access and tackling profit.
Awesome. And then before I let you guys go, MJ, you had mentioned that this is from the audience. The first list of drugs for negotiations will be released September 1st. Can you talk about, I know we don't know what those drugs will be, but will there ever be more drugs added to that? Is the final goal that all drugs will be negotiated? Can you just share a little bit more about that?
Yeah, under the current law, it'll get up to 25 brand name drugs. This week, I didn't mention this, but this week, yesterday, the three ranking members, the three highest ranking Democrats on committees of jurisdiction, education and labor, energy and commerce, ways and means, introduced a bill that would expand the number from 25 to all drugs in Medicare, and then would take negotiated prices from Medicare and apply those prices to the commercial market, to the private market. So it's a pretty important bill, because what it would do is take the reforms that are starting to be implemented in Medicare and apply those reforms to the private market. Probably the most important is negotiated drugs. And the second, which is also really, really important, is a provision that now exists in Medicare by which prescription drug corporations that raise their prices faster than the rate of inflation. About a third of the drugs in Medicare last year, the drug companies raised prices by over 7%. Inflation was just about hitting 7%. They do that pretty routinely. But now when they do it, they have to pay a rebate back to Medicare. So then that money gets reabsorbed into Medicare to pay for people's services. So it creates a major disincentive for drug companies to just keep jacking up prices as fast as they want. We really want that expanded to private insurance, because the 150,000 people who have private insurance are also not protected from whatever whims the prescription drug companies have, raising their rates however they want to, whenever they want to, on whatever they want to. So, the Medicare negotiations, the current, as it currently states, will get up to 25. People won't see those negotiated prices until 2026. The year 2026 is when they'll start to get lower prices. But my suspicion is that, particularly if Democrats gain more governing power in Congress, we're going to see a lot of efforts to expand the number of drugs and to apply those negotiated prices broadly beyond Medicare.
That's fantastic. And, another shout out to Assemblywoman Considine, who had AB 250 out here during the legislative session to rein in those drug costs. We're very happy that she ran that bill, very bummed that it did not get signed into law. All right. Well, thank you so much, MJ and Amber, for joining us. Thank you so much to Andrea and to Senator Rosen as well. I've learned so much about our healthcare system. MJ, every time I get a chance to talk to you, I learn something new. So thank you so much. And Amber, thank you so much for sharing your story. And thank you to everybody who tuned in with us this evening. I hope y'all have a great rest of your week. Have a great Friday, and we will see y'all soon. Thank you.